Good evening, everybody. This is Dr. Kenja Sabri. I am going to give you a summary of Chapter 6, Data Management. The medical record may be used for continuity of care, ongoing care for patients, and other healthcare professionals, future and ongoing clinical decision-making, operational management of the facility and all of its resources, whether that be personnel and equipment, legal support for providers and patients, medical research and education, as well as reimbursement. So the medical record is going to be your primary data source. Your secondary data source is going to be registries and other databases. So patient identifiable data, that's going to be data that can be linked to a specific individual. And then your aggregate data is data on groups of individuals that do not identify specific individuals. So the purposes of secondary data is going to be to support healthcare operations, to perform research, to identify patterns and trends in patient care, to support long-range planning and budgeting, and to provide benchmarking information. So some users of the secondary data, you have internal users as well as external users. So your internal users are going to be your medical staff, your administrative staff, and the management staff. Your external users are going to be your researchers, public health agencies, state and federal databases, as well as local governments collecting vital statistics such as birth and death rates. We'll talk more about that later. So healthcare data is known as big data due to the massive quantities collected. As we organize the data, sublists or indexes help to support more effective and efficient searches. So these are some facility-specific indexes. You have your master patient and your population index, your disease index, which is an ongoing list of all diseases and conditions treated within the facility, your physician index, which is a list of all physicians, including hospitalists, and those with privileges to care for patients in the facility. Your master patient index, we talked a little bit about this on Thursday. That's going to be your computerized list of all patients treated within the facility. Your operation index, that's the ongoing index of all surgical procedures performed in the facility. Another index or another example of an index is going to be your charge master, also known as CDM, charge description master, which is an index of all billable items and services, their cost to the facility, as well as the amount to be charged for those services. So here are some registries defined. So the definition of a disease registry is a collection of secondary data related to patients with a specific diagnosis, condition, or procedure. Your case definition is going to be the description of the cases to be included in a disease registry. Your case findings is going to be the process of identifying patients who've been treated for the condition, defined as the subject of the registry. So here are some examples of the many registries. I mean, there's so much more, but this slide only lists a few. We have trauma, cancer, birth defects, diabetes, implant, transplant, and immunizations. For cancer registry, you can have two types of registries, your facility-based and your population-based. But let me go back and tell you what these are in case you are not familiar. Cancer registries were developed as an organized method of collecting cancer data. So the registry may be facility-based, as I mentioned, or population-based, which gathers data from more than one facility in a geographic location. Your case definition is the process of deciding which cases should be entered into the registry. In the facility-based cancer registry, the first step is case finding. One way to find cases is through the discharge process in the HIM department. When a case is first entered into the registry, an accession number is assigned. An accession registry of all cases can be kept manually or provided as a report by the database software. Cancer staging is the process of determining the size and extent of the spread of the tumor throughout the body. A staging system is a classification system that describes the extent of the cancer within a patient. So formal reporting of cancer registry data is done through an annual report that goes to the State Central Cancer Registry and the CDC. The following organizations have developed standards or an approval process for cancer programs. Over these next two slides, I want you to be conscious of the acronyms and write them down so that you're familiar, okay? So if you're interested in becoming a certified cancer registrar, CTR, you can visit the website for the NCRA for additional information and eligibility requirements. Trauma registries. So the trauma registry is a database that maintains patients with severe traumatic injuries. A traumatic injury is a wound or another injury caused by an external physical force, such as an automobile accident, a shooting, a stabbing, or maybe even a fall. Such injuries include fractures, burns, and lacerations. Two examples of data collection tools used for trauma registries are the AIS, which is the abbreviated injury scale, and ISS, which is the injury severity score. AIS reflects the nature of the injury. I keep wanting to say industry of the injury and the severity to the body system. The ISS is the overall severity measurement calculated from the AIS scores for the three most severe injuries of the patient. So reporting varies among trauma registries. So the standards and agencies for approval is going to be your American College of Surgeons. And in case you didn't know, there is a certification, the CSTR, which is a Certified Specialist in Trauma Registry. So some more registries. Registries in general may be developed for any type of disease or condition. So examples of emerging registries include HIV and AIDS, cardiac, gastroenterology, sudden unexpected infant death syndrome, and the National Provider Identifier, the NPI registry. Okay, so now we're going to talk about database management and design. With the integration of technology into HIM professionals must interpret the terminology within the physician's documentation and translate it into a language that can compress many important details into a presentation understood by other professionals and computers. So my example here is going to be coding classification systems. And we'll talk more about that later. However, we're not going to talk about coding classification systems here. We're talking about that translation for the computer. Okay, so the translation for the computer is where the database management systems come in, because the database management systems are software tools used to store, analyze, modify, and access data. So relational databases are most widely used in numerous industries, including healthcare. There are three steps to database design: conceptual, logical, and physical design. The process of formalizing data requirements and the structure used to organize data is called data modeling. Your entity relationship modeling is a type of conceptual modeling. Conceptual models are abstract and encourage high-level problem structuring, helping to establish a common ground for communication between users and developers. So implementing the database using a specific database management system is the goal of the physician design phase. SQL is the formal language used to retrieve information stored in a relational database. The NoSQL data model is also referred to not only SQL. It differs from the relational model in that it does not provide a table-based representation. Okay? It uses either a document or a graph-oriented model. In addition, there are also other several languages of which HIM professionals need to be aware. So like for example, I'm thinking DSM, which is your Diagnostic and Statistical Manual of Mental Disorders. We have CDT, which is your current dental terminology. We have SNOMED CT, which is your systematized nomenclature of medicine. HL7 is another example, which is your health level 7, which is the list of standards for the exchange, integration, sharing, and retrieval of electronic information. So I hope you find that helpful. So other examples of healthcare databases are GEM, the General Equivalency Mapping, which is used to translate from one classification system to another. Your Hospital Compare or Nursing Home Compare, which is information on how well hospitals provide recommended care to their patients. For those of you who may work in home health, OASIS is an example. That's another abbreviation you want to write down. And the way that I remember this is my home is my oasis. So your OASIS is a core assessment data that measures adult outcomes of those receiving home health services. Okay, so that's how I relate OASIS to home health. Your Uniform Health Discharge Data Set is another example, your UHDDS, and that's going to be your data collected on all hospital discharges. So some other healthcare databases that's mentioned on this slide, is the MedPAR, the NPDB, and there's several state administrative databases, as well as national and county public healthcare databases. Okay, so vital statistic databases house birth, death, fetal death, marriages, and divorce records, and the responsibility rests with the state. Your clinical trial databases is a research project in which new treatments and tests are investigated to determine whether they are safe and effective. So I'm not going to talk through this slide. I just want you to pull out those acronyms. So remember on Thursday, I mentioned getting with your quality manager or quality director. These are things that you can ask them about, the AHRQ and the HCUP. But again, take down these acronyms. Okay, so processing and maintenance of secondary databases. So although registries and databases are almost universally computerized, data collections is sometimes done manually. Okay. The most frequent method is abstracting, which we also talked about already. Abstracting is the process of reviewing the record and entering required data elements into a database. So some registries may be a vendor created product at times, and then others may be a part of the facility's health information system. There are data security and confidentiality concerns as it relates to secondary databases. So as you may have seen in your textbooks, patients have concern that secondary data collected about them could affect their employment or their ability to obtain health insurance. So trends in the collection of secondary data. Trends, the increased use of automated data entry, more stakeholder involvement in national policy regarding secondary data, and then the role of us, HIM, our role in stewardship. of secondary data. So look out for that. Okay, so data quality. One aspect of HIM professionals' responsibilities is to train, monitor, and ensure that all data used within the facility complies with characteristics of quality as required by our industry, right? So data quality standards, so we talked a little bit about this, but anyway, the characteristics of quality are accuracy, that being no errors, no typos, no misinterpretations, but your accuracy is also known as validity, okay? Accessibility. Data must be available to those who need it when it's needed. Data must be complete, which means all required details are included. This can also be known as comprehensiveness. Consistency. Data must be reliable, credible, trustworthy. Timeliness is also a characteristic. So that means that the data must be up to date and current. Interoperability is also a characteristic of quality, and that means that all those who need to share data must be able to share data. And lastly, the last characteristic is going to be granularity, which a data is presented at its smallest, most specific detail. Okay, so data dictionaries, I think, is the last concept covered in this chapter. Your database management systems are software tools used to store, analyze, modify, and access data. Okay, so there are two types of data dictionaries. One is a database management system, and then the second one is the organization-wide database management system. And then your chapter talks a little bit about development guidelines. I think that it's important to read, though I don't necessarily think that this in its entirety is going to be on exam. Okay, well, I hope this quick recap of chapter 6 helps. If you have any questions or comments on this chapter, or if there's something that I covered that you're not entirely sure about, or you need me to go into more detail, be sure to comment below and I will answer your questions as quickly as I'm able. Thank you so much.